Well, since it's on the exact same ballot I really would rather not take an official position because, I'm not supporting anybody else except for a few good friends on down the ballot. But I will tell the citizens of Missouri this. Here's the thing with Medicaid expansion. Yes, it will very likely increase access to health care. And it will possibly short-term save the state of Missouri money and save hospitals money. Now, the problem with it is based on a federal funding formula. And with that federal funding formula, if it's changed, it could cause some serious budget issues for the state of Missouri. We're already to the tune of about $21 billion that we get more from the federal government than we send that way. So that makes us just a little bit more of a debtor state. And like I said, if they change that funding formula, we could end up very much in the red.
Whether you support Medicaid expansion or whether you don't, it's really going to come down, can you afford it in the state of Missouri? And the reality is we're number 5 in the nation. We're 5th in the United States for spending on Medicaid now in the state of Missouri. And we know even a conservative estimate is going to be somewhere about, the cost of it's going to be $175 million to $200 million. Every state that's expanded it, it's cost more money. There's really never been any savings to it wherever you go. It's just a matter of do you want it or do you not, and are you willing to pay for it? And to realize right now that if you are going to pay for Medicaid expansion, something's got to give. You got to take the money's going to have to come from other resources, and that's just a fact. There's no easy way around that. So. Again, it just depends on where you want to put your money at and what's most important to everybody. I really believe right now for Missouri, if you really look at our record in Medicaid, we do a good job of taking care of people in need. I really do. But again, it's going to be up to voters to decide that, but it's all going to come down to me is can you afford it or can you not? And right now I can tell you with where the economy is, where we're at in this state, it would be much better to do this down the road or have this discussion down the road than it will be here in August.
The farmers and the small business owners were hurting even before the pandemic. And I think COVID, obviously it's been very bad this year and we've lost lives, but it's also opened the eyes of not just Missouri, but the rest of the nation on problems that we had in the past, even before COVID. So for instance, you mentioned the cattle farmers and specifically, they have been affected even before COVID. And now this year, it's even worse because there are 4 main processing plants that most of the cattle farmers use, and 2 of which are owned by Brazil and China. The other 2 are owned by U.S. companies. But those 4 main processing plants basically monopolize the industry. So our cattle farmers are not able to get their cattle sold. And they also, they set the prices as well, the processing plants. And so this has been an ongoing problem for almost probably a decade or more now. And it's just getting to a point where we have our farmers that are about to lose their businesses. And these are our small cattle farmers. They're about to go out of business. And these are farms that have been in their families for generations and generations. And we, like I said, with COVID, this is just kind of, opened the eyes of people that aren't farmers, because during COVID, we saw that there was no meat on the shelves. And so people started asking those questions like, well, where's the meat? We know there's cattle farmers. We know there's cattle. What's going on? And it's because those 4 main processing plants, one of which closed down temporarily and really just disrupted the market there because they set the market. So here in Missouri, we really need to get our own processing plant, a large facility that our cattle farmers can use so that they can almost like probably like a co-op where they own it themselves, that they can get their cattle there, and we would never have this issue again in the future. And we need to get China out of our farmland. Small businesses were also hurting before, but COVID has really, really hurt our small businesses. And these continued restrictions that are in place, like the masks and the contact tracing, none of which makes sense for these businesses, and it's all very inconsistent. There's just no common sense here, and it's continuing to hurt our small businesses while they have to have these restrictions in place for their customers, a lot of which will just turn around and walk out if they have to put their name and address and have their information down, or they have to wear a mask. We're already seeing, they're saying Walmart is now going to make mandatory masks. We're already seeing all over Facebook people say, well, Walmart just lost my business. I'm going to go elsewhere. I'll get my stuff online. And that's what's happening. So I would never mandate any of these types of restrictions. I think it's also a constitutional violation of our constitutional rights to mandate these kinds of restrictions, especially when the numbers are not anywhere near they were in the very beginning. And those were trumped up numbers that weren't even accurate, just no one knew what was going on. And so now that we have a realistic picture, there's a 98% survival rate on this virus. And so I just think we need to get back, back in business. We need to help our farmers and our businesses to get going again, because the longer we keep these restrictions in place, the more they're going to hurt, and the more our economy is going to hurt.
Okay, let's talk about healthcare. So what are your thoughts on the Medicaid expansion in Missouri?
So I do not think Medicaid expansion will be good for Missouri. I do understand we need to help our healthcare industry, and we need to help people be able to get healthcare that they need. I just don't believe Medicaid expansion is the answer. To me, it's a form of Obamacare, which I do not think was good for our nation either. And I think once it goes in place, people are going to see that it's not actually what they thought it would be. It's actually going to put us in a lot of debt as well. And I was very, very concerned that it was switched over to the August ballot, because people normally come out and vote for something that they want, and they'll purposely go out to vote for something that they want. So we're going to have a lot of people that want Medicaid expansion to pass that will come out in the primary to vote for that. But you're not going to have people that don't care, or it doesn't affect them in any way. Those people aren't going to come out to vote against something. And so we're going to see a lot more people come out in the primary to vote for Medicaid expansion, and we're not going to have those people that are going to come out to vote against it. If they would have left it in November, when you're going to have all the Trump supporters and Republicans and everyone come out, and everyone comes out for a November election anyway, when you have all of those people come out, and you have, a lot of Democrats, and you have people that are for Medicaid expansion all come out in the November election, it had a better chance of not passing in the November election, as far as I'm concerned. And so I have to assume that Medicaid expansion will pass, and we'll have to budget for that. But I do not think it's good for the state of Missouri. I would have liked to find other solutions for the issues with healthcare that would have been more beneficial for the people of Missouri, and would have actually done more than what Medicaid expansion is going to do for Missourians. For instance, there are certain areas in Missouri that are hurting worse healthcare wise, where they can't get to a facility. Like, for instance, the Boot Hill. Okay, so I was in the Boot Hill in 2018 when I ran for auditor, and they were hurting back then already, and a lot of their hospitals were closing down. So they weren't even able to get to a hospital that was close by, and they weren't able to afford it. Trump has started doing something that I think is very beneficial, and I'd like to take it even a step further here in Missouri and make healthcare a lot more transparent. So what he is doing is he's making, and I believe it starts in January, but I'm not completely sure on when, but I believe it's in January, that he is making all of the healthcare facilities put online what their actual costs are. So I'm interested to see what they actually put online, because as you know, healthcare facilities will charge more when you have insurance than when you're paying out of pocket. So if you're paying out of pocket, they have this really reduced rate. But if if they're charging your insurance company, it's a crazy, crazy amount of money for some of these services. And I worked in the healthcare field. I was a med tech in the Air Force. And so I do understand the cost of healthcare, but I think it is completely outrageous how much they charge for procedures, for medication, all across the board. So I think it's a great first step that he's putting that information, or making them put that information online, so that we can see what those costs are. But I am interested to see what they're actually going to put up. Are they going to put the costs up that they charge the insurance company? Or are they going to put up the cost that they charge you out of pocket if you don't have insurance? So being more transparent and making them be more transparent is a good first step, but cutting costs to healthcare is what I want to do. And so I want to work with the healthcare facilities, the doctor's offices, ways to cut costs, not just for procedures and for, doctor's visits, but also for our medication, because I'm sure you're aware how crazy expensive that is as well. And with that, again, and Trump, I think is doing some things with this. I've not really followed everything he's doing yet. I know he has plans, but to actually get our pharmaceuticals out of China. So until COVID, again, COVID has opened our eyes to a lot of things. Most people, including myself, did not know that over 93% of our pharmaceuticals come from China. And so I want to work, especially, here in Missouri as governor, I want to work to get China out of our pharmaceuticals, and really China out of our state. But by going through and revamping this, making healthcare more affordable, we would then not need the Medicaid expansion for a lot of people. Now, there'll still be other people they'll still need more help there. So as governor, I'm over all the state agencies. And what my plan is with the state agencies is to go into each one and make it more effective, more efficient, cut red tape, and it'll be cutting costs. And so this way, when we eliminate a lot of the red tape, eliminate a lot of the inefficiencies that are there. I've worked in state government. I was at the Attorney General's office and the Secretary of State's office, and we worked with a lot of the state agencies. So I know a lot about how the state runs, and it is not good. There's so many things that we could just quickly change, but going into even every state agency, cutting all those things, that is going to bring in revenue in a lot of ways, and it will also cut spending. So we will be able to increase pay for our workers, but also be able to increase benefits that way for the people of Missouri. So I'm going to come at it from both levels, from state government being able to give more benefits from the state, but also work with healthcare facilities for them to cut costs as well. That way, not needing the Medicaid expansion that they're trying to pass right now.